human rights. We're trying to safeguard Hong Kong. We don't want Hong Kong to be China.
China's government says the changes are needed to combat separatism, terrorism and foreign interference, all labels it has used to describe Hong Kong protesters. Beijing's representatives in Hong Kong, like the city's unelected chief executive Carrie Lam, say only a small number of people will be targeted. She promised Hong Kongers, for the time being, will retain the freedom to say what they want. Another pro-Beijing figure, former official Regina Ip, says the national security laws are overdue.
If we become a threat to national security or a base for subversive activities, the separate systems cannot be maintained.
It looks inevitable that the national security laws and the Anthem Bill will pass. China's grip on Hong Kong is tightening, but the gulf between how people view politics in Hong Kong and the mainland is only widening.
The ABC's Bill Birtles with that report. The family of the African-American man who died after being pinned by his neck by police wants the officers to be charged with murder. George Floyd died in Minneapolis yesterday after a white police officer knelt on his neck for several minutes. The 4 officers involved in the arrest of Mr. Floyd have been sacked, but the protests have erupted on the streets with people calling for justice. A warning, some may find aspects of this report from the BBC's Nick Bryant disturbing.
This is the scourge of police brutality, a disease America has never been able to cure.
I cannot breathe. You just a grown, you're a tough guy.
An African-American pleading for air as a white officer pressed his knee on the back of his neck.
Check his pulse. Okay. Check his pulse, Kyle.
Onlookers tried to help, but after being taken to hospital, George Floyd was pronounced dead. The 46-year-old was being arrested following reports of the use of counterfeit money. What unfolded next we've seen many times before. Protesters filling the streets carrying placards asserting that Black Lives Matter, and a curbside shrine, this time at the spot where George Floyd was pinned down.
I just want to say that we are sick and tired of being sick and tired. Too many lives have been taken. Yesterday what we saw was a black man who was lynched. Right? They didn't use rope. He used his knee.
Then the fury broke loose. Protesters targeting a police station in Minneapolis, wrecking a patrol car and pelting the building. Officers responded with a volley of tear gas and their own version of events.
He physically resisted officers. Officers were able to get the suspect into handcuffs, and officers noticed that the male was going into medical distress.
But security camera footage from the scene did not show George Floyd resisting arrest. This has become another American ritual, an African-American family going on television to express pain and dismay.
They treated my brother like a scumbag. They left him there to die. They act like he was a piece of trash and just wanted to leave him there.
Race has always been the angriest fault line in American life. And even as the nation finds itself at the epicenter of the COVID pandemic, we're watching it erupt again.
The BBC's Nick Bryant with that report. Staying in the US, where the death toll from the coronavirus has surpassed 100,000, accounting for 1 in 4 deaths worldwide. According to Reuters figures, around 1,400 Americans have died on average each day in May. Here's CNN's Nick Watt.
Just to put that in some context, 100,000, that is more Americans than were killed in the Vietnam War, the Korean War, and Operation Iraqi Freedom combined. Also, some people have tried to compare this to the seasonal flu. Well, we are also now approaching triple the average death toll for seasonal flu, and this virus is nowhere near done yet.
Nick Watt there. Meanwhile, President Trump has threatened to shut down social media companies after fuming about being labelled with a fact-check strap on Twitter. 2 of the president's tweets yesterday were flagged as needing fact-checking, and Twitter linked to articles from CNN and The Washington Post, 2 of Mr. Trump's sworn enemies. He's now accused Twitter of stifling free speech and says social media platforms are silencing conservative voices. The White House says the president will soon sign an executive order regarding social media companies. To South Korea now, where there are signs of life returning to normal. More than 2 million students have returned to school today, but not everyone's happy about it, as the BBC's Laura Bicker reports from Seoul.
This is part of a phased return, so a series of students go back every week. But teachers are on edge because there are clusters of infection popping up across the country. This is all related to an outbreak in nightclubs in Seoul's Party district a couple of weeks ago. Now, health officials have traced 86,000 people and tested them for the virus, but still these little pockets of infection keep cropping up. And that is why every single student must wear a mask. At the gates, they are having their temperature checked. That's the first temperature check of the day. There are many kind of temperature checks throughout the day. Each of the classes have dividers in them to keep students apart. Daily, teachers are telling their students to keep that social distance, but it is extremely difficult. As you can imagine, this is the first time that they've seen each other in months. This is the start of the school term, which was supposed to happen in March, so they are very excited. I saw one student jump up and down, desperate to hug her friend, but was told no by a teacher.
Laura Bicker with that report. Vietnam has been a global success story in limiting the spread of the coronavirus. Despite sharing a long border with China, it recorded just 327 cases and no deaths. Its government took drastic action to get its emergency plan into place and began a hugely effective contact tracing operation. Professor Guy Thwaites is director of the Oxford University Clinical Research Unit in Ho Chi Minh City. He told me the speed of the response was crucial.
They started acting very early. They had their first case in the middle of January. It was one of the first cases to leak out of China. And they started to put in place education, they started to put in place quarantine, and they started to restrict travel almost immediately, actually. And I think that was one of the key secrets to their success, because in doing that, they were able to keep the numbers to manageable amounts, and they were able to keep quarantining and keep contacting and contact tracing, and that allowed them to keep control of the epidemic.
How were these measures received by the public, and were there any kind of penalties for breaking the rules?
In general, they were very well received. You've got to remember that this is a country that's quite used to infectious diseases. It's used to infectious disease outbreaks, and people are very respectful of them, really. So in 2002, we had SARS, and then 2003-04, we had avian influenza, the first cases actually in the hospital in which I'm sitting now. And subsequent to that, there's been big outbreaks of measles and dengue and hand, foot and mouth disease. And so the population are very used to managing outbreaks and doing the right thing to be able to control them. So on the whole, really, there was very little resistance to the measures, if you like, that were being put in place.
That was Professor Guy Thwaites, the director of the Oxford University Clinical Research Unit in Ho Chi Minh City. Cyprus has pledged to cover the costs of anyone who tests positive for the virus while holidaying there. The government says it will pay for accommodation, medicine and food for patients and their families. Patients will only have to pay for the taxi ride to the airport and flight back home. It's part of a package of measures aimed at drawing visitors back to the island, which has reported fewer than 1,000 cases. Tourism accounted for 15% of the country's GDP last year, so understandably the government is keen to bring travellers back as soon as possible. And that's World Watch for today. Back to you, Mani.
Thanks, Annabelle. And that's Midday Report, Te Purongo o Te Pautūtanga for today, Thursday, May the 28th. Stay tuned to RNZ for the Ministry of Health's COVID-19 briefing with Dr. Ashley Bloomfield. We will also be streaming that on our website, rnz.co.nz. We can also listen back to today's interviews. We'll be back tomorrow with interviews and the latest news from Aotearoa and the world, coming up to the news at 1 now with Paul Brennan. But from me and the entire Midday Report team, kia tau te mauri, kia pai o koutou rā, heia pōpō.
RNZ News at 1. Kia ora, good afternoon, I'm Paul Brennan. A consumer watchdog says Air New Zealand is holding on to millions of dollars of its customers' money from cancelled flights. A Consumer NZ survey of 2,000 customers found only 6% had been refunded. Jordan Bond reports.
The average amount of money tied up in limbo for those surveyed was $2,200. Most people haven't had their money back after paying for flights they never went on due to COVID-19. Instead, the airline has given them flight credits of the same value, but many of those surveyed don't know when or even if they'll be able to use them. Consumer NZ says Air New Zealand has shortchanged its customers and is calling for refunds, with some people short for cash and needing that money to live on. This is Jordan Bond.
A man about to be taken into court escaped custody in Papakura this morning by scaling a barbed wire fence. The police say 21-year-old Cody Evans, who had been arrested for driving offences earlier today, was being transferred from a prisoner truck at the time. They say staff tried to stop him, but he got away. A search has been mounted for Mr Evans, who the police say is dangerous and should not be approached. He has a small build and was wearing a ripped black puffer jacket, shorts and black ankle socks. Parliament has passed under urgency legislation allowing a special 12-week welfare payment for people who have lost their jobs because of the pandemic, at $490 a week untaxed. In fact, we'll leave the...
Kia ora koutou katoa, talofa lava. Welcome to today's briefing. Today there are again no new cases of COVID-19 to report in New Zealand, our 6th day in a row without any new cases. So the total remains at 1,154 confirmed cases. There are 12 additional recovered cases, and this total is now 1,474. We only have 8 remaining cases considered to be active. I've also been asked to provide some comment today on the death of Aileen Hunter, a resident from St Margaret's Hospital and Rest Home in Te Atatū, Auckland. We're providing Aileen's name following a request to do so by her family. Aileen was in her 90s. She passed away on Sunday, and she was much loved by all those who knew her. She was confirmed as having COVID-19 in mid-April and had been transferred from St Margaret's to Waitakere Hospital and then to North Shore Hospital for care. Once recovered, with 2 negative test results, she was transferred back to St Margaret's Rest Home. The family has asked the Ministry to pass on their thanks for the care of their mother at St Margaret's and at both Waitakere and North Shore hospitals. And in turn, I'd like to extend our sympathy to her family for their loss. Now, it's important to note that Aileen was regarded as having recovered from COVID-19 at the time of her death, and COVID-19 is not recorded as the primary cause of her death on her death certificate. However, after consideration, we have decided to include Aileen's death in our overall tally of COVID-19 related deaths, consistent with our inclusive approach to date, so that we have got a good idea of the full impact of this condition on our health and wellbeing in New Zealand. This means our total number of COVID-19 related deaths is now 22. Again, today there is nobody in hospital with COVID-19, and yesterday our laboratories completed 4,255 tests, and the total number of tests completed to date is 271,690. An update on the NZ COVID Tracer app. It's now had 436,000 registrations. That's 14,000 more than yesterday. I continue to encourage as many people as possible to download the app. It will help us identify, trace and follow up anyone who may need to be followed up if they are a close contact of a case, should we get one. I'd like to also recognise the work being done by businesses and thank them for their work in downloading the QR code. It is quite a process to register for a New Zealand business number. However, thank you that now 18,500 posters are up in businesses around New Zealand, making it easier for people to use our new app to keep a record of where they've been. Just finally, some comments from the World Health Organization. Our numbers today reinforce that New Zealand continues to do well in its efforts against COVID-19, and we need to continue to work together to keep ourselves in that position. The WHO has reminded countries about the need to be careful when relaxing restrictions that have been in place around movement of people, including coming out of lockdown type situations. As the WHO has observed, epidemics tend to come in waves, and a second wave will continue to be a possibility in New Zealand for a number of months from now on. So we need to continue the hard work we've all put in to ensure we continue and maintain our 0 cases, our ongoing downward trajectory, and that we don't allow a second peak to occur. So heading into the coming long weekend, stay safe and well. I'm open to questions.
On air crews, are you working on a plan for pilots and flight attendants coming into the country? There's been concerns raised that seeing as they don't go into quarantine, that could be a way for cases to come in?
Yes, that is a potential risk, and so there is already a very clear plan in place and very clear guidelines around what crew have to do during flights in either direction, and also when they are staying over at destinations. This is particularly for Air New Zealand crew. We're working with the airlines at the moment on looking at ways we may even be able to strengthen that further. That is particularly for flights that go beyond Australia, so flights out at the moment. Air New Zealand has flights two to Asian destinations and one to Los Angeles, and we're just looking at how we can make sure that the risk there is really low, and also because we know airline crew are at that increased risk, they will be part of the surveillance testing that we will be doing around the airports and borders to help guarantee that we are keeping, the border tight.
So is there something you'd like to see the crews do more of when they're, say, walking around LAX before a flight?
Oh, well, there is very strict guidance for air crews about what they need to be doing, particularly in Los Angeles, both in going through the airport terminal and when they're in their accommodation over there, to help ensure that they're keeping themselves safe and also that they're not carrying any risk of bringing COVID-19 back into New Zealand. And I think that's particularly the destination where we have the most concern about, and that's the one we're looking particularly at other measures we might need to put in place. Please.
With so many days with 0 cases and so few active cases, can you reiterate why we're staring down the barrel of another 4 weeks at alert level 2, and whether there might be some room for movement if we have 0 active cases, if we get to that point?
As we've said before, this virus has a long tail. And I think one could even say, look, the announcement of a further death today from an infection that happened some time ago shows just how long the impact of this disease can be there. And we have also seen that some people are testing positive quite a long way after they might have originally been infected. So there's that aspect of it, but there's also the important aspect, the pillar of our elimination strategy, and that is keeping it out at the border. We've been successful to date since going into alert level 3 and 2, actually since we started the lockdown, and we want to make sure that is all watertight, especially if we're contemplating opening up travel with Australia, which would be under a reciprocal no quarantine required basis. We're stepping through this. I think we've stepped into level 3 and into level 2 rapidly. We've increased the size of gatherings. And as I said yesterday, the work is continuing apace on what alert level 1 might look like, and also our advice around when it would be appropriate to move to alert level 1.
How confident are you when Aileen was sent back to St Margaret's from hospital that she didn't have COVID?
I'm very confident, and I'm confident because the clinicians who sent her back were confident, and I have full confidence in their judgment, and as well as their clinical judgment. Of course, there were the negative tests as well.
When is it going to be okay for businesses to get back to life as usual in the office? I mean, some government departments have said they won't even be back to full strength, even under level 1. I mean, do you think government departments should be leading by example and telling people it's safe to go back?
Well, it's safe to go back now. I think there are 2 different issues here. One is we still have the guidance around physical distancing inside the office and work environment. That remains in place. That will be one of the things that will be different in alert level 1, and we're working through that now. But I think there's a second issue, is the experience that workplaces have had of working remotely, which is something that many workplaces have been doing at the margins, and now we've had a sort of a forced experience of it through alert level 4, and workplaces have found actually it is both beneficial for the staff, but and also for productivity. And so I think we'll find many workplaces, even when this is over, the workplace will be different. There will be people who are doing more remote working and also less travel around because we've now all become very proficient with the use of Zoom for meetings.
I mean, flexibility is one thing, and that's fantastic that people have that option. But if social distancing is no longer required under level 1, why should government departments be telling their people to stay home?
Well, I can't preempt what government departments will be doing in Alert Level 1, but I can speak, say, for the Ministry of Health, where we've surveyed our staff and got very positive feedback on the arrangements that were put in place in Alert Level 4, and over 70% of staff would be happy to retain a mix of working both in the office and at home remotely. So I think, again, it's less about a concern around safety of the workplace. I think all workplaces have been very focused on ensuring their staff are safe. But even as we move into Alert Level 1, I think we will see a change in the nature of work in that way.
What's the official position on the use of face masks for air travel? And just can you clarify for us, is it elimination or eradication aiming for?
So the advice around face masks for air travellers, they are neither recommended nor required, but not discouraged. So saying the international airline staff, as part of the precautions they take, they wear a face mask and gloves when they're in the main cabin and dealing with passengers. So not required on flights either domestic or international. On the second issue, the strategy is elimination, and I think the difference is here. Really, eradication will be a global effort. It's very hard for New Zealand to say we're on a pathway to eradicate a virus that clearly is still incredibly prevalent and growing in prevalence offshore. And we are very interested in opening up our borders more and more. And in that case, yes, elimination remains the strategy because it's going to be a prolonged effort. And the vaccine, of course, will be part of that in due course.
What will it take for the ministry?
There are talks of plans to fast-track the return of international students to New Zealand. Do you have any concerns about that, given that COVID is far from over in much of the rest of the world?
I don't have particular concerns about international students any more than I would other groups coming if we've got really tight processes around managed isolation and or quarantine when they come, coupled with appropriate exit measures from where they come from. And note here, the significance of the 0 cases here is not just that we've got no cases on shore, but we're not seeing any coming through the border, which suggests that the measures that are in place in the countries where people are coming from are also good, so we're not importing infections into the country. There's a question over here.
On the trans-Tasman bubble, from a health perspective, obviously the sort of final decision will remain with the Cabinet, but from a health perspective, where would cases in Australia need to be for you to be comfortable with us opening borders? They've had more than 100 in the past 2 weeks, for example, whereas we've had 5 or something like that. Where do you draw the line?
So I think from a number of cases perspective, well, from a health perspective, there are 2 relevant things here. One is the cases and the pattern of cases and whether there is evidence of community transmission where it's not clear where they've come from. That would be a concern. So that we'll be looking at that. And then, of course, there is the full pathway of people coming across the Tasman and going back and making sure that any risks could be managed there. Both countries will be interested in that. But again, I think the key thing we'll be looking at in Australia is where are the cases and can they be explained? And those are the things that will be influencing decisions inside Australia about travel between states as well, I would imagine. So I think we will see once there is a degree of comfort with travel between states in Australia, then it may well be they feel they're ready, and I can't preempt the decision by the Australian leadership. They're ready for that trans-Tasman arrangement.
Does the same apply to the Pacific? I mean, what would it take for the Health Ministry to give the green light for including the Pacific in the bubble?
Yeah, so we will give advice around that if asked. My own view is that again, the risks can be managed well, especially if we've got countries that have got good testing in place, and we know that they haven't got any cases, and that the arrangements can be put in place for travel to and fro. I think that many Pacific countries will be interested in seeing if an arrangement can be put in place, because their economies are so reliant on tourism. And so the Pacific is, I think, has always been a focus of our efforts in response to COVID-19, and it will be in terms of opening up travel. But I haven't been asked for specific advice on that yet.
The University of Auckland sent out a letter yesterday where they said that they are going to be offering the government residence halls as an option for quarantine and mandatory isolation of incoming international students. Would you be open to expanding those systems beyond hotels to new venues?
Yes, the venue is one thing. It's the incredible arrangements that are in place, and having visited one of the hotels in Auckland last Friday, it's quite a complex operation, 24/7, health oversight, security, the way food is prepared and delivered, the arrangements to ensure people can get out for physical activity, making sure the well-being of those people in the hotels, or in this case in student halls, was being looked after. So if an accommodation block is appropriate, that's fine, but it's really the ability to stand up all those services around it. And just a reminder that at its height in Auckland, there were over 500 people involved in those arrangements. It's still somewhere between 300 and 400 people to provide that full range of services across the 12 hotels there in Auckland at the moment.
Do you know when was the last time we had a case of community transmission?
In the first part of April, having gone back and looked at all the cases, in particular those ones where it was not entirely clear exactly where the transmission or where the person may have been infected. Please.
I'd like to know what feedback the Ministry of Health got from the Prime Minister around her Early Movers initiative with world leaders last night, whether anything of interest came out from the Ministry?
I haven't actually followed up or had any feedback yet from the Prime Minister, but I'll be interested to see what that is. But the PM herself may well speak about that.
Tomorrow
Please.
midday.
Question.
Apologies if you were asked about this yesterday, but we have a reporter who is usually a correspondent in Australia who's in managed isolation in Auckland at the moment, and he says he was rung by Healthline 3 separate times telling him that they lost his information, and it was due to a technical issue. Is this something that you've heard about, or is it a common problem that you're aware of?
No, it's not something I've heard about, so I'm happy to look into that. The hotel I visited, which was managed isolation, one of the ones in the Auckland CBD, actually the health checks there, and I imagine it's the same, that the daily health checks are done by nursing staff who are actually on site. I met the group of nurses at the hotel I visited, and they do either phone calls to people in their rooms, or they see them personally. They've got a special area set up for that each day. So I'm not quite sure what the Healthline issue was there, but I'm happy to look into that.
They were saying that they didn't know when he'd arrived in New Zealand, where he'd come from, what hotel he was in, or how much longer he'd be there.
And he's there at the moment, is he? Yeah. Okay, we can check that.
Tomorrow midday, the country are allowed to have gatherings of up to 100. Are there any major concerns that you have that we further interested?
No concerns. That was our advice, and I'm also confident that New Zealanders will keep following the precautions and expectations of them, including registering and just looking after each other, whether it's out in a public venue or at home in a private setting, or at a special occasion like a wedding or funeral. We've still, got to keep keeping each other safe, and I encourage people to do that. Any final questions?
Yes, sir. I've asked the Ministry of Health to provide data of healthcare workers infected in their workplace, and they haven't been able to do that. Is that good enough? Given it's a workplace issue?
Actually, there are data already on our website around healthcare workers and how and the proportion that have been infected either in their workplace in a healthcare setting or in other settings. So I'm not sure if you were looking for detailed data on every healthcare worker. I'm not sure we would have that level of detail available, but I'm happy to follow up your inquiry.
Yeah, isn't that something that should be available, given it is a sort of health and safety issue? If someone is infected with a deadly virus in their workplace and they say that they don't have data, or they've told me they don't have the data on the number of healthcare workers who were infected with that healthcare.
Yep. That surprises me because I think for about a month, probably a month ago, I started to talk about the number of healthcare workers, broke them down by groups, and also what the place of likely infection was. So let me just check that, and if those data haven't been updated, we'll make sure they are. Final question.
On the vaccine strategy, there's been some concern raised, including by a member of Parliament, that there would be some level of forced vaccinations for COVID-19. Can you address this?
Yes, people may have raised it as a concern. It's not something that's in our thinking, because I don't think we will need to force people to be vaccinated against COVID-19. And I imagine that everybody, just as they have in our efforts to date, will be keen to ensure that both they and their families are protected, and also that they're contributing to our wider community effort, and they're protecting others, in particular vulnerable New Zealanders who would not do well if COVID-19 was still circulating in the community. So I think we've crossed that bridge when we get to it, but I'd be very surprised if New Zealanders don't get right in behind an effort if the vaccine's made available and they can get one. Okay, thank you very much. Appreciate it. Have a good long weekend.